Good afternoon, everybody. I just signed the fiscal year 2018 budget into law. Our administration from the beginning has been committed to providing opportunity in every zip code to make our communities stronger, our schools better, and our economy stronger from the Berkshires to the Cape. By signing today's budget, I'm proud that through bipartisan collaboration with the legislature, we are increasing investments in education, local aid to cities and towns, and efforts to fight the opioid epidemic, all without raising taxes on the people of Massachusetts. Strong communities start with strong education, and our administration has prioritized Chapter 70 funding for local schools to support our teachers and students. With this budget, funding for local schools will grow by 2.6%, one of the single biggest increases at $119 million in this budget, to $4.74 billion total in fiscal 18, the highest level ever. The $119 million increase over last year's spending represents a total increase of almost $350 million during the past 3 years. This is the largest investment in Massachusetts schools in the Commonwealth's history. The budget also incorporates a formula for the foundation budget with a significant increase to the health care factor, based on our House 1 proposal. Addressing the escalating health care costs was the single biggest recommendation from the Foundation Budget Review Commission, and when fully implemented, this reform will represent the broadest expansion of the foundation budget since it was originally adopted in 1993. Fiscal year 17 and the second half of fiscal 16 should serve as important reminders to all of us how important it is to operate a state budget that lives responsibly within its means. Total revenues for fiscal 17 are projected to come in approximately $420 to $450 million below benchmark, and fiscal year 18 projections are about $750 million below the consensus revenue estimate that was made back in December of 2016. Despite slower than anticipated revenue growth, we are still able to fund increases to important state services for our schools, our cities and towns, and our citizens without drawing down on the stabilization fund or raising taxes. We expect to make a deposit in fiscal 2018 of about $98 million to the stabilization fund, building on the progress we've been making since 2015 to pay down long-term obligations and end the previous practice of drawing down our reserves to pay for operating expenses. With fiscal year 18's deposit, the stabilization fund will have grown by nearly 30% since we took office. As former local officials, Lieutenant Governor Polito and I understand the importance of supporting local aid to give municipalities the leverage they need to make the best investments they can in their schools, their roads, their communities, and their downtowns. The FY18 budget supports our cities and towns with a $40 million unrestricted increase, bringing that total to over $1 billion. And over the course of the last 3 years, despite tough times on the revenue side, we've been able to provide a $116 million increase worth about 12.5% to Massachusetts cities and towns. Funding in fiscal 17 will also allow the Community Compact Cabinet, chaired by Lieutenant Governor Polito, to continue their important work to help cities and towns develop best practices and fund local projects. It's also been 2 years since we filed supplemental budget to begin funding the recommendations of our opioid working group. And since then, we focused on implementing policies aimed at prevention, intervention, treatment, and recovery support, including the passage of landmark legislation that features prevention education for students and doctors and the first in the nation 7-day limit on first-time opioid prescriptions. It goes without saying that we still have a lot of work to do here, and as a Commonwealth and as a nation, to fight this public health crisis that continues to destroy lives and families. I hear the gut-wrenching stories from parents and loved ones who've lost someone to opioids and heroin pretty much everywhere I go. And while there are no easy answers, we are fully committed to tackling this at every level from the state to the federal government. This budget funds $185.3 million worth of services across state government, not counting the Mass Health Program, which is an increase of over 50% since we took office. With this funding, we will provide 45 additional treatment beds for Section 35 civilly committed males and continue to fund the 45 beds for women's addiction treatment services at Taunton State Hospital, which was added in fiscal 2017. Our budget also provides critical funding to support the most vulnerable population in our Commonwealth and those who tirelessly provide support services for them. The Department of Children and Families will be funded at $941 million in fiscal 18, which will allow the department to sustain 450 new employees hired in fiscal 16 and 17. Since taking office, we've taken a number of steps to help DCF carry out their mission of keeping thousands of Massachusetts children safe from abuse and neglect, including an overall increase of $100 million to the department's budget, hiring nearly 600 new employees to address the critical infrastructure that was needed to run the agency, which represents 279 social workers, 125 social work technicians who support those social workers, 42 supervisors, 30 area program managers, and other support staff, including the department's first clinical infrastructure and first medical director in 2016. And with the continued collaboration of the Social Workers Union, SEIU Local 509, we've also made significant progress toward achieving an 18-to-1 caseload ratio and a 4-to-1 supervisor to area program manager ratio, while also implementing new policies on protective intake, supervision, family assessment, and action planning and case closing. For several months, our administration has had a public, ongoing dialogue with the legislature, the healthcare community, the business community, and other stakeholders about addressing a $300 million budget gap for Mass Health. While this is a complicated topic with many moving parts, we've made clear that this year's budget needs a comprehensive approach to controlling rising costs and ensuring Mass Health stability over time, while protecting the safety net and delivering quality health care for our residents. The updated package we recently presented to the legislature, as requested in both of their budgets, was the result of several months of discussions with the business and healthcare community to build a package that made sense for the Commonwealth. It preserved healthcare benefits and included long-term structural reforms to control Mass Health spending. While the legislature included a couple of our proposals, we heard their message that they wanted more time to discuss and understand the implications of it. With that in mind, we'll be returning the amendment. We will be returning with the amendment several sections, including the unemployment insurance adjustments and employer medical assistant contribution, the so-called EMAC, which is expected to generate $200 million in revenue in fiscal year 18. These reforms are necessary to prevent an unfair burden on Massachusetts employers and healthcare providers. So today, we're proposing a more comprehensive and balanced approach that reinforces the shared commitment between the public and private sectors. In addition to the employer contribution, I'm recommending several reforms, including initiatives that would better align the Mass Health program with commercial products and coverage, and measures to ensure that Mass Health is a secondary payer when individuals have access to employer-sponsored coverage. This proposal will provide savings in fiscal year 2018, as well as longer-term savings that lay the framework for a more sustainable Mass Health program over time. Without taking these reforms up in a timely manner, corrective action will be needed to make up for the corresponding revenues and savings associated with this proposal. Therefore, we're requesting that the legislature hold a public hearing on this proposal within 30 days and act upon it within 60 to ensure that we achieve the necessary savings and revenue in fiscal year 18. These Mass Health reforms are necessary not only to balance this year's budget, but they're also necessary to ensure the healthcare safety net remains financially secure over time. These reforms are also necessary to protect taxpayers from having to pick up the tab for more and more worker-based healthcare. Finally, we are committed to the commercial market reforms that were included in the original package, but will be filing those proposals through separate legislation so that they can be pursued through committees. We're also pleased that this budget supports a number of other important areas across the rest of state government, including an annual $2,000 tax credit for employers who hire a veteran for 2 years, language to support eligibility expansion for approximately 2,400 Gold Star spouses or families each year, and we'll begin a new workforce development program called Learn to Earn, with a $1 million appropriation that will pull together community-based organizations, staff from social service agencies, public housing, veteran services, and career services to steer individuals that they know are looking for work but lack skills toward training programs that will give them an employable skill set. We also propose fully funding Turning 22 for young adults with developmental disabilities for the first time this year, and the $5.6 million increase in this budget brings us closer to that goal. I want to close by thanking Secretary Kristen Lepore and her terrific team, many of whom are here, the chairs of the House and Senate Ways and Means Committees, and the Conference Committee for all of their hard work so that we have a state government that lives within its means here in the Commonwealth. And in light of last week's announcement, I'd also like to wish Chairman Brian Dempsey the very best of luck in his new job, and say thank you on behalf of our administration for his collaboration over the last few years, and welcome Representative Jeff Sanchez to the team. And I look forward to our continuing collaboration with the legislature this year and in the future. And with that, I'm going to turn it over to the Lieutenant Governor.
Thank you, Gov. Good afternoon. I'd also like to echo the Governor's sentiments about the continued bipartisan collaboration that exists here in Massachusetts and certainly is exhibited in this budget. I also want to thank Chairman Dempsey for his leadership in this Commonwealth. I had the opportunity to serve with Chairman Dempsey when I served in the legislature for about a decade, and it was a pleasure to be able to work with him as Lieutenant Governor on 3 budgets, and we certainly wish him well, much happiness in his new endeavors. When we came into office, we made a commitment to all of our communities in this Commonwealth, all 351 cities and towns. And I'm very pleased, despite the challenges that we had to consider in this budget, that we can maintain and uphold our commitment to all 351. As in this budget, we continue to support our communities with, as the Governor said, a $40 million increase in unrestricted local aid. This is very important dollars for the town managers and mayors and selectmen and school committee members to use, totaling over $1 billion in more revenue to them. Also, in addition to more than $4.74 billion worth of funding for our local schools. And I'm very pleased, obviously, having worked very closely with our cities and towns to see the Community Compact program continue in this budget. There are over 300 communities participating actively in this program, which represents almost 700 best practices embedding in local government today. $6.8 million in both the Compact and related programs continue to support our cities and towns with technical assistance, best practices, and more updated and modern ways to delivering service to all of the people of this Commonwealth who live in our communities. We're also looking to help our communities not only in their budgeting, but also in providing the most essential service of government, which is public safety. We're continuing to make progress on youth violence and gang activity through diversion and suppression and education programs, and funding this to the tune of $6 million of Shannon grants in our budget. Our administration's first budget funded a new state police class that graduated last spring, and we're pleased in this budget to build on that and to add another police class for the state of 145 recruits. And some of these recruits eventually will wind up in another important role, as we are funding what's called the 5th Division of the Massachusetts State Police. And this will allow us to modernize and update the kinds of programs that the state police need to work on. And this is focused on homeland security and preparedness. Particularly, this division, which you'll be hearing more about, will consolidate, streamline, and strengthen the counterterrorism and criminal intelligence operations of our Massachusetts State Police, making all of the Commonwealth cities and towns a safer place in which to live, to work, and to raise a family. It will also increase efforts, strategic efforts around opioid trafficking and human trafficking interdiction efforts, working with our counterparts in the region. These 2 efforts are very important to all of us in government and to the people of this Commonwealth. We want to thank Colonel McCune and the legislature for their coordination on making this possible, and we will be looking forward to working with them in the months ahead to see the fullness of this program take hold in Massachusetts. I also have the opportunity to chair the Governor's Council on Sexual Assault and Domestic Violence, and this council advocated, along with my colleagues in the legislature, for important funding. More than $31 million for the DPH domestic violence and sexual assault prevention and treatment programs, nearly $5 million for DPH's sexual assault nurse examiners and pediatric SANE nurses in our Commonwealth, and a $170,000 increase over FY17 for the Department of Transitional Assistance to annualize funding for 8 domestic violence specialists and to achieve the placement of 1 specialist per DTA field office. Lastly, I co-chair our council addressing matters of STEM in Massachusetts, and I'm very pleased to see us continue to build upon our success in terms of being a leader among all of the states in education. We, in this budget, are funding school-to-career connecting activities to the tune of $3.15 million to provide STEM-related work-based learning experiences to high school students. Bringing more of these students into the workplace and more of the workplace into the classroom is what's working, and we need to do more of it. 15 community colleges will continue to operate the STEM Starter Academy to encourage and help students enroll in STEM coursework and begin STEM careers in Massachusetts, and we're funding that to over $4.25 million. And more than $2.5 million to encourage more kids, particularly those in underserved populations, to engage in the subjects of STEM, and we were able to fund fully their participation in advanced placement classes and courses in math and science. I'm pleased to be able to highlight a few of these initiatives. Obviously, this wouldn't be possible without the hard work and collaboration working with our legislative colleagues, but the tremendous effort that many in this room put forward, sacrificing time from families and friends and important weekends where we could enjoy maybe time over the 4th of July. You were here in this building working through the details of this budget. I want to thank Secretary Lepore for her leadership. She has an incredible team, and I know she's going to acknowledge them. Thank you.
So thank you, Governor and Lieutenant Governor, for your leadership in the development of our 3rd budget. Despite modest tax revenue growth over the past 3 years, a trend many states are seeing, we have responsibly managed spending while building our reserves and making strategic investments in core services and priorities, many of which were outlined by the Governor and Lieutenant Governor. This budget keeps spending in line with revenue growth, reduces the state's structural deficit by 90%. The budget we are signing today relies upon $125 million in one-time revenue, compared to $1.2 billion used in FY15. It increases the stabilization fund by $98 million, growing it by nearly 30% since the start of our administration, from $1.1 to $1.4 billion. It responsibly keeps to the schedule to pay down the Commonwealth's unfunded pension liability by 2036, with an increase of $196 million to the pension fund transfer, and once again does not rely on new taxes or fees to balance the budget. These measures solidify our state's fiscal condition, allow us to make critical investments, and protect taxpayer dollars. Based upon projected FY17 year-end revenue, and with a range of updated forecasts from economists provided last month, our actions approving this budget today assume $749 million less in state tax revenue than originally projected in FY18. This amount is $99 million lower than the assumptions upon which the conference report was based. And while the conference committee report provides a new $104 million reserve that authorizes the administration to address some known deficiencies, we believe there are $198 million in unavoidable deficiencies which will need to be addressed in FY18. Therefore, we are vetoing $320 million gross, $193 million net in spending to address the additional deficiencies and the lower tax revenue projections. The budget assumes savings in our Mass Health program that is only achievable if the Mass Health reforms that were developed with many outside stakeholders over the past 5 months are adopted. It is essential that the Mass Health package that we have returned with an amendment today be passed expeditiously to ensure the long-term sustainability of the Mass Health program and the state budget. Passage of this package is essential to this budget being in balance. I want to acknowledge the hard work of the Ways and Means Committees in adjusting spending and revenue expectations in the conference budget, and thank Chairman Dempsey and Chairwoman Spilka for their continued and strong collaboration throughout the budget process. I want to give a special shout out to Brian Dempsey and thank him for his service and partnership for the past 2.5 years, and congratulate Chairman Sanchez on his new and very important role as House Ways and Means Chair. Lastly, I want to thank my fellow cabinet secretaries, especially Secretary Sutters, not only my colleague but a very dear friend, and my entire A&F budget team for their tremendous work to ensure that once again we have a balanced, fiscally responsible budget. Thank you.
Questions?
Governor, I assume in the leadership meeting you just had, Speaker and Senate President, you spoke about the mass health changes. Do you have any conversations with them about the time frame you're looking for action and the possibility that it's going to bump up against the traditional August recess when you're looking for action in 2 months?
Well, remember, we originally proposed an employer fee in our budget back in January that would have raised about $300 million and dealt with our concern, which was the number of people who were moving on to mass health and out of employer-based coverage. The legislature expressed an interest in that. We discussed it quite a bit for several months. And then in April, the House put a budget out that basically said, you guys should go find a way to come up with a different solution for this that you believe the business community and others can support. In May, the Senate basically bought off on that. We started working on this with the business and healthcare community in April. And in June, we gave them a package that represented a series of reforms on the mass health side, as well as a different approach to dealing with the employer community that folks in both the business community and the healthcare community were comfortable with. The message we got from the legislature at that time was, that's a pretty creative proposal. We'd like a little time to process it. So we're probably not going to include it in our ultimate submission to you. We believe that giving them 30 days to hold a hearing on this, which they said was their primary concern at this point in time, and then another 30 days to deal with the issues that may come about as a result of that, and continuing to work with them on this will make it possible for them to get comfortable with these ideas and to reach some conclusions on it. But the way we structured this in our response to their decisions in their budget was to send it back amended and to presume that they'll be dealing with it sometime in the next couple of months.
Does it make you uncomfortable at all to sign a budget that's essentially $350 million out of balance as we stand currently?
I don't believe it's out of balance. I believe that there's still work to be done on it that requires some public discussion. And I also believe, based on the comments and the conversations we've had with them, that they appreciate the importance, the significance, and the seriousness of this, and that they will act quickly on it.
Is the money that you have vetoed that and gross part of what they would then, if they passed your, in 60 days, if they passed this, would that money be restored?
Well, we amended the EMAC sections as part of our return. So if they act on the mass health stuff and they act on the package more or less as we send it back to them, then there won't be a change with respect to the money piece other than the one that we projected as part of our assumption about getting to balance.
And if they don't, what's the change to the money?
I think if they don't do anything, I think we'd probably be $350 million on a gross basis. 100. That's a gross number, right? We'd be.
Yeah, that's a net number.
That's a net number. All right. Should have let them answer it. So that means we'll be $350 million out of balance at that point in time. But I fully expect that they're going to deal with this.
But you would veto down to that number at this point, or?
Well, keep in mind that we're dealing with a revenue assumption here, right? The EMAC piece is a revenue assumption. That's $200 million. The $100 million on the savings side, now is that a net number or a gross number?
It's a net number.
That's a net number. The $100 million net on the mass health side is a spending number. Our anticipation is that we will get the EMAC or some version thereof and a mass health plan or some version thereof, and we'll just implement it.
What if after 60 days they're still not ready to accept the mass health plan?
Well, if they don't send us back the employer assessment, I don't believe we could implement it. Is that correct?
No.
Yeah.
But could they send you back the assessment but not the other reforms? What would you do?
We were asked to negotiate a package, We negotiated a package. We think that package accomplishes three objectives. The first is it creates an opportunity for employers who currently have many of their employees on the Mass Health program to contribute to the cost of their coverage. Second thing it does is it creates a number of significant opportunities to sustain and stabilize the Mass Health program. And the third thing it does is it creates what was once a fairly structured relationship in Massachusetts under our old program that we implemented before the Affordable Care Act that established a pretty solid relationship between commercially based health care coverage and Mass Health. And those are three objectives that you talk to anybody in the House leadership or the Senate leadership will tell you were a big part of the conversation we started to have with them back in January, and they believe in those three objectives.
Governor, have you had a chance to review the compromise the House and Senate reached over marijuana today?
Nope. That's true, we really haven't.
Are you unfamiliar with any of the details? I mean, how do you feel about a maximum 20% tax rate on pot?
Honest to God, we have not seen any of it. And by the way, the committee has reported this out. Have they? We don't even know at this point when they're planning to take it up in the House and Senate and vote on it. Do you?
They plan to have a bill on your desk by the end of the week.
Okay.
Formal schedule for Wednesday.
A maximum 20% tax. What do you think about that rate? Is it too high?
Well, we've said all along that we want the tax rate to be high enough to cover the costs of administering and managing the program and enforcing the law. And what we've also said is that if the rate turns out to be too high, based on how much it costs to actually do all those things, the Commonwealth should be willing to adjust it downward. And if it turns out that it's too low, we should be willing to adjust it upward to deal with whatever the cost of the program is. That number, as you just described it to me, sounds like it would be among the lowest tax rates for marijuana in the country. But if it's what it takes to cover the cost of administering and managing the program, that'd be fine with us.
Governor, you've been a proponent of allowing city councils and boards of selectmen to make the decision on
Yep.
banning. I know you haven't seen it yet, but reportedly their conference committee kind of splits the bill with it, which allows cities and towns that voted for question 4 to have it by referendum, and cities and towns that voted against question 4 to do it by governors. Is that a fair way to do it, given that demographics change, people's minds change?
Well, I want to see the language before we comment on it, but conceptually, that's not an unreasonable place to go.
Governor, why are the R&D and state police not using the identify and foster program to crack down on folks who are obtaining licenses under false pretenses?
Well, first of all, I'm not sure that's the case. Secondly, we worked very hard as an administration with the legislature to enact Real ID here in Massachusetts because we did not believe that people who weren't here lawfully should have access to a driver's license. And we were successful in our efforts to get that law enacted, and we are in the process of implementing it. And Real ID will be implemented here in Massachusetts probably by the spring of 2018. We also have ongoing training between the state police and the people who work at the registry on fraud intervention and fraud protection and fraud referral mechanisms all the time, and are constantly updating our fraud identification and fraud referral programs, including working with a number of nationally accredited organizations to ensure that the people who work at the Registry of Motor Vehicles have access to the best and most successful information on how to do this.
This seems like a very successful program. Why not use something that's proven its success many times over statewide?
Well, I guess the first thing I'd say is that the programs that are used by administrative organizations are usually different than the ones that are used by law enforcement. It's a different role, it's a different set of responsibilities, and generally speaking, it involves a different set of techniques. The registry does do a lot of its work in conjunction with the Mass State Police and works very closely with them to ensure that they are, in fact, acting on what the state police and others in the field consider to be the best standards with respect to reducing fraud. But as I said, we wouldn't have worked so hard on finding a bipartisan solution to implement Real ID here in Massachusetts if it weren't for the fact that we believe that people in Massachusetts who aren't here lawfully shouldn't have access to a driver's license.
Thanks, everybody.